Hello, this is James Lowry with James Lowry Hypnotherapy, where I, with the help of a medical provider, aid adults suffering with immune disorders in relieving the emotional stress surrounding their discomfort in order to achieve a better quality of life in as little as one session. Today's frequently asked question is, how common are immune disorders? Now, before I answer that question, I want to make it abundantly clear that the information I am presenting is not to serve as a substitute for medical advice. My role as a hypnotherapist is to serve as an effective adjunct to those already receiving medical treatment who might need additional care. How common are immune disorders? It is estimated that roughly 15 to 50 million Americans have an immune disorder. At the core of many immune disorders are maladaptive responses of one's neurology, one's nervous and immune systems, or perhaps a combination of all three. The end result for a lot of these maladaptive responses is some form of inflammation, either skin, joint, musculoskeletal, organ, or perhaps a combination of all of these, which for a lot of individuals is experienced through some form of pain or discomfort. Now, with so many million Americans suffering from some form of an immune disorder, with 75% of those having genetic or hormonal factors at play also influencing these maladaptive responses, it would only be reasonable to assume that medication is not always able to treat the conditions of a lot of these individuals suffering from an immune disorder. So, how does one effectively deal with these maladaptive responses where medication has failed to effectively treat them? Well, luckily, and perhaps even unfortunately, however, there is a little known branch of science known as psychoneuroimmunology, which studies how one's neurology and one's nervous and immune systems all interact with and affect one another. At the core of psychoneuroimmunology and its applications in the form of mind body therapies, such as hypnotherapy, is looking at where attention is placed, the degree to which that attention is gathered and maintained, and the overall emotional quality or flavor of that attention. Mind body therapies, such as hypnotherapy, aim to therapeutically affect attention in this way so that individuals reestablish a healthy communication between their neurology and their nervous and immune systems. Now, you might be thinking to yourself, but James, I've tried talk therapies before and it didn't work for me. How is this different? Well, most therapies, even meditation, aim to alter or bolster your conscious perception of the problem. But let me ask you something. If you could consciously decide right now not to have the problem you're experiencing, it would only be reasonable to assume that you would consciously do so, would you not? If you could have consciously decided not to have taken on the problem at all, it would again only be fair to assume that you would consciously have decided to do so by now. So the problem you are experiencing, the discomfort and the maladaptive psycho-emotional responses that surround it, do not effectively exist in the conscious mind. Rather, they are most predominant in the unconscious mind. So if you're looking to adopt this kind of therapy, in which, with the help of a medical provider, helps you in relieving the emotional stress surrounding your discomfort in order to achieve a better quality of life in as little as one session, then give me a call or book a free consultation at James Lowry Hypnotherapy. I'm always happy to help.